Okay, imagine this. A disease that spreads completely silently, hiding inside millions of people for decades before it finally shows the damage it's done. That's pretty much the story of hepatitis C. But, and this is the incredible part, this isn't just a story about a problem. It's a story about a cure we actually have. So let's break down how we got here.
Let's start with a number. 71 million. Just let that sink in for a second. That is a huge number. To put it in perspective, that's more people than the entire population of the United Kingdom.
And yep, that's what we're talking about. The estimated number of people around the globe living with a chronic hepatitis C infection. So you can see, this is not some small niche issue. We're talking about a massive global health challenge, one that puts an incredible strain on people, their families, and, of course, healthcare systems everywhere.
But here's the real kicker. The part of the puzzle that makes this so tricky. What if most of those 71 million people have no idea they have it? Because that's the reality. And that, right there, is what makes hepatitis C so incredibly dangerous.
And that brings us right to the heart of the problem, you know? Hepatitis C is what you'd call a silent virus. It doesn't exactly send out a press release when it arrives. Nope, it just works quietly in the background, sometimes for decades.
For a lot of people, the initial infection is so mild, they might not even notice it happened. Any early symptoms are usually super vague stuff we all feel from time to time, like being tired or just not feeling 100%. And this is the perfect cover for the virus to set up shop, establish a chronic infection, and start its slow, quiet attack on the liver. All of this without ringing a single alarm bell.
So you're probably wondering, how does this stealthy little virus even spread, right? Well, understanding that is absolutely key, not just for prevention, but for figuring out who really needs to get tested.
All right, so first things first, hepatitis C is a blood-borne virus. In developed countries, the main way it spreads is through injecting drug use, especially from sharing needles. And here's a bit of history that's really important. Before about 1991, blood transfusions were also a major source of infection because we just weren't screening for it yet. Now, there are other risks. They're less common, but they're still there. Things like accidental needle sticks in hospitals, some risk through sexual contact, and it can even be passed from a mother to her child during birth.
Okay, so this is where things get really interesting. And honestly, a little scary. Let's talk about what's actually happening inside the body when this infection just sits there, undiscovered and untreated for years or even decades.
It's a really slow but steady path of damage. First, you've got the chronic infection. This means the liver is just constantly inflamed. So what does it do? Well, over time, the liver tries to heal itself by creating scar tissue. That process is called fibrosis. The analogy of rust building up in a machine is perfect. It just slowly clogs everything up. If that goes on for too long, you end up with cirrhosis. That's when the liver is so scarred and hardened that it can't do its job anymore. And from there, well, that's when you can get into really severe, life-threatening complications like total liver failure or even liver cancer.
So yeah, the stakes are obviously really high, and that makes getting a diagnosis just absolutely critical. The good news? The whole process is actually super straightforward. Nothing invasive or complicated.
It's basically a simple two-step deal. Step 1 is an antibody test. This just checks to see if your body has ever met the hepatitis C virus before. Now, if that comes back positive, hold on. It doesn't automatically mean you're sick right now. It just means you were exposed at some point. That's why step 2 is so crucial. It's an RNA test. This one is different. It's actively looking for the virus itself in your blood. And if that's positive, okay, then we know for sure there's an active infection that needs to be treated.
And right here, this is where the whole story just completely flips on its head. I mean, for decades, getting a hepatitis C diagnosis was grim. The treatments were brutal, they lasted forever, and you never really knew if they'd work. But in just the last few years, wow, we've seen nothing short of a medical revolution.
So the whole goal of modern treatment is to get to something called a sustained virological response, or SVR for short. Yeah, it sounds super technical, but it's actually really simple. It just means that 12 weeks after you stop taking the medicine, they can't find any trace of the virus in your blood. Gone. In other words, it's a cure. I mean, the difference between the old days and now is just night and day. It's staggering. Think about it. Hepatitis C went from being this chronic, lifelong disease you had to manage with these awful, year-long interferon injections, the ones with terrible side effects. It went from that to a curable infection that you can treat with just a simple course of pills.
The outcomes went from being a total crapshoot to being incredibly predictable and successful.
These miracle drugs are called direct-acting antivirals, or DAAs. And just look at these numbers. They're incredible. We're talking about a round of pills that you take for just 8 to 12 weeks, with a cure rate over 95%. And get this, the modern ones are pangenotypic, which is just a fancy way of saying they're like a master key. They work against all the different strains of the virus. It's a total game changer, no question.
Okay, so we've established it. We have a cure. That's huge. But what does that really mean? You know, for an individual's health and for all of us, for public health in general.
Well, the benefits are just massive. First off, curing the infection stops the liver damage dead in its tracks. It massively slashes the risk of getting liver cancer or liver failure. And what's really amazing is that the liver can actually start to heal itself. It can reverse some of that scarring. But it's not just physical. It improves people's quality of life, it gets rid of that stigma of having a chronic disease, and crucially, once you're cured, you can't pass the virus on to anyone else. You break the chain of transmission.
And hey, don't just take my word for it. This quote from the European Association for the Study of the Liver really spells it out. The goal of therapy is a complete cure to prevent complications, improve quality of life, remove stigma, and stop the virus from spreading. That's the whole mission, right there in black and white.
So, that's where we stand today. We have this silent epidemic on one hand, but on the other, we have a cure that works more than 95% of the time. This science has done its job. It's delivered this incredible tool. Which really leaves us with one big final question, doesn't it? A cure exists. So what's it going to take to find all those millions of people who still don't even know they're infected and finally, truly, make hepatitis C a thing of the past?